let's say you just hurt your back. Ouch. Your back just went out. The first thing you want to do is find a position of comfort. I would suggest lay down, because sitting will probably only worsen the condition. So what I'm going to do, I just hurt my back, is I'm going to try to lay down. Oh, it hurts. I can't barely move. Take some deep breaths. Your low back has been injured. It just happened, and you don't want to make it worse. The first thing you have to do is try to get off of it and lay down. And lay on your side. If you can't lay on this side and it's increasing the pain, you got to just slowly get up again to find a new position. Let's say this feels better for a second. Take some deep breaths. Let's stand up. That makes it worse. So let's sit down. Let's try this side. What I'm doing is trying to find a position of comfort. This is the first thing you should be doing, is finding a position that you can lay in, which decreases your pain, which decreases your symptoms of sciatica if you're experiencing that down either leg or both legs. What I'm demonstrating is finding that position of comfort. This is the very first thing we have to do. Now I'm laying on this side. Oh, it feels a little better, but the leg here, the angle it's taking down, doesn't feel good. So in that case, we'd have to find a pillow and put it in between our knees. That feels a little better. I could actually lay here comfortably and take some deep breaths and not panic. Don't panic. Don't panic. Just lay down. Find a position of comfort. Well, let's say 10 minutes has passed, 5, 10 minutes has passed, and you're starting to feel uncomfortable, or you need to go get your phone. Let's see. This is going to be really, really slow. So we have to get up very carefully because we have an injury in the lower back that we do not want to worsen. It's very, very vulnerable at this point. You don't want to be running around town, run into your chiropractor right away, running to the emergency room right away. You don't want to be doing any of that. You're in the very first phase of the injury, which is to decrease the chance of making it worse. So we're getting off of it. All right, I gotta go get my phone just in case, so I can, while I'm laying down here all day, I can check some emails, I can keep myself busy. Let's try to go get it. Oh, it hurts so bad. Deep breath, slowly, little by little. You've never felt so weak before. Something's definitely wrong, but don't panic. right, we're gonna try to get on the legs. It doesn't feel good, but I'm able to stand. I'm a little wobbly. You want no weight bearing, so you want to support. You want to hold on to support as you travel, and don't rush. Move slow. Move very, very slow. So I got my phone. Now everything's hurting. It's worse. We're gonna lay down again. Ow! 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 Oh! Ow! Ow! Oh! So, the next time you get up, you should be getting ice. An ice pack of some sort, and you want to put it right on the small of the lower back for 15 to 20 minutes. Take it off for an hour. Let the blood vessels come back to normal, to room temperature, to body temperature, and then take the ice, put it after that hour, put it back on for another 15 to 20 minutes. And you can repeat this process. 15 to 20 minutes of ice on, 1 hour off. So this will probably go on for about, worst case scenario, 2 weeks of doing this type of stuff. But after the first 2 or 3 days, it should be a lot easier. If you just listen to what I say and don't panic in the beginning, and don't go all over town trying to seek pain relief. This video is strictly just for that first phase of pain, right when your back goes out, what to do. Proper management. We're going to teach proper management about lower back pain, lower back management at each phase. This is the very, very first one. Ouch, just hurt the back. What do I do? Get off of it. Sitting's gonna make it worse. Being on your feet too much is gonna make it worse. The only thing that's gonna not injure your back further at this point is laying down. So you gotta lay down. If you gotta get up to go do something or get something, do it very slowly. Do it very, very slowly. It's gonna be very painful. You're gonna be very stiff. Your muscles are spasming because they're trying to cast that area to protect you from increasing your range of motion, further damaging the injury to the lower back. I keep saying injury, specifically a disc, a ligament, a sprain, a strain. Something happened, your back just went out. What do? This is what we do. We get off of it. Okay, so now it's stiffening up again. So slowly, gotta get up. It's gonna take forever. You gotta get up slowly. You may have to be on your knees a little bit. Oh my God, I've never felt so weak. Oh. So I can stand a little bit. So I can go do something, loosen up. And then when I come back, I'm gonna do the same thing. I'm gonna lay down. If I can lay on my stomach, I'm gonna try to lay on my stomach as long as I can. As long as I can. If I can do it for 10 minutes, 5 minutes, 10 minutes, 15 minutes, 20 minutes, 1 hour, I'm gonna just stay here as long as I can. The fact that you can lay on your stomach after a low back injury improves the rate of recovery. It means you're going to recover faster if you're at the stage where you can already lay on your stomach. If you're at the stage where you can only lay on your sides, and that seems to be your only position of comfort, then do that as long as you can. Slowly over a period of 1 to 2 months, hopefully sooner, depending on you, hopefully in a period of less than 1 to 2 months, you're able to lay on your stomach. This will definitely improve your prognosis and just the health of the lower back as well, the discs, the anatomy. So if you're at the phase, okay, we're laying on our stomach, this is great, preferably with an ice pack on the small of the lower back. 20 minutes on, 1 hour off. We're going to repeat this behavior throughout the day, throughout the work day. Any chance I get, I'm going to lay on my stomach or lay on my sides, taking pressure off of the lower back, taking pressure off of the discs. So it's morning time now, so I'm going to work a full day, and I'm going to avoid sitting for too long. I'm going to avoid walking around for too long. I'm going to see my patients. In between patients, I'm going to find a position of comfort laying down. I'm going to do this all day. And tomorrow, I'll probably have a much better day. I didn't have to go to the chiropractor. I didn't have to go run all over town seeking orthopedists and x-rays and things like that. That's not what we're ready for. That's later down the line. But right now, as a chiropractor, I'm talking to you and telling you what to immediately do right when you hurt your back. The low back pain is very complicated. There's chronic cases, there's acute cases, there's a lot of other things that could be going on, but right when you hurt your back, this is what you do. To get back to, this is proper management. What I see a lot of is just mismanaged lower back pain because the patient's scared. They're in pain, they're scared, and they don't know what to do. So I'm making this video because I've said these words at least 1 million times in my life. So I need to make this video for anyone who has just hurt their back and doesn't know what to do. And then we'll guide you through each stage. But this stage could last, up to a couple weeks before you are able to seek proper help, and I'll guide you through that. So next video, we're going to talk about what to do when you're starting to feel a little better. You're moving around, you can do your daily activities again. But at this stage, you lay down a lot, you stay off of it a lot, you baby yourself, you ice it. And if you must work or must do your laundry or anything around the house, you have to bring those objects or come to those objects very, very close. Even if it's like a spoon, you got to come as close to that spoon as possible before you lift it. I don't want you to reach. No reaching and grabbing or lifting and please don't try to stretch away the pain. Don't try to crack the pain away. Don't try to exercise the pain away. Don't try to walk the pain away. This is an injury, and it needs to go through its course, its proper inflammatory course of repair. The first stage is 2 weeks. So respect the repair phase, the inflammation phase. I'll guide you through it. This is step 1.